In 1961, President Kennedy called on all Americans to rise to the challenges of the day. He knew that success depended upon the unity of efforts throughout the federal government and the nation. The Greater Boston Federal Executive Board, one of 28 across the country, fosters communication, coordination, and collaboration with federal, state, and local government agencies. This is your federal government, and I am your host, Diane LeBlanc. Hello, everyone. Today we are featuring the Health Resources and Services Administration, which is part of the United States Department of Health and Human Services. Our guests today are Regional Director for the Department of Health and Human Services, Rachel Kaprielian, and Dr. Christopher Bersani, who is with the Health Resources and Services Administration. Welcome to you both. Thank you for being here.
Thank you.
Thank you for having us.
Director Kaprielian, I want to start with you. You are new to the federal government, but not new to public service, certainly. Mm-hmm. Can you just give folks a little bit about your background and what brought you to the Department of Health and Human Services?
Sure. Well, thank you for the introduction. I appreciate that. Yes, I have had a career in public service. I look back and it has spanned every arena. It has spanned municipal. I was a city councilor in my hometown of Watertown. I was then a state representative representing Watertown and Cambridge in the Mass Legislature, which I did for 13 years. After that, I ran everybody's favorite agency, the Registry of Motor Vehicles. And then after that, the last year of the Deval Patrick administration, I served as his Secretary of Labor and Workforce Development. And now here I am at Health and Human Services, which kind of feels like a full circle from when I was in the legislature and very active on healthcare reform and other matters pertaining to health and wellness.
Excellent, excellent. A distinguished career, certainly. And you made some wonderful improvements at the Registry of Motor Vehicles. So you did some exceptional work there.
Thank you.
And we're pleased that you're now with the federal government. And Dr. Bersani, a little bit about your background, what position you hold with the agency, and you're wearing a military uniform. So maybe if you could explain that to our viewers.
Sure. I'm Chris Bersani, and I'm with the Office of Regional Operations within Health Resources Services Administration. And I'm a clinical psychologist by training. And I've had about a 20-year career in the federal government with the Department of Defense and with the Department of Justice, and in the last 8 years with Health Resources Services Administration. My job most recently has been in the area of public health with regard to my work with the Health Resources Services Administration. The uniform is the Public Health Service uniform, or the Commissioned Corps of the United States of America, and our ultimate boss in the Commissioned Corps is the Surgeon General of the United States. Okay. So some of our federal colleagues wear uniforms, and we are the Commissioned Corps, and others, like Rachel, are civilian service.
Excellent. Thank you for that. Director Kaprielian, the regional head of the Department of Health and Human Services. Health and Human Services has many various components. If you could speak to just your overall responsibilities for the region, and what have been your challenges maybe in the first few months on the job?
Well, the first challenge is learning all the acronyms.
There you go.
For how many there are in the federal government, as you well know, as a retired federal employee. But it is a really fascinating part of the world to look at, sort of health and human services from the lens of New England, which is what my region is. Okay. And it's all the New England states, and I'm able to learn sort of how legislatures manage grants, what they have for Medicaid waivers. The federal government is responsible for a great deal of funding that flows into states for providing services for people from birth, whether it be Head Start or Healthy Families, all the way up to the end of life with Medicare. So the Center for Medicaid and Medicare Services, CMS, is probably the most active and biggest of our 13 operating divisions of different agencies within HHS. So the regional director's office is sort of an umbrella over all these other operating divisions to make sure that we're harmonizing, that we're working together, and that different states' priorities around health and wellness and health and human services. I want to mention human services because it isn't just healthcare, not just Affordable Care Act, that we're working in a coordinated way, and we're trying to help people get access.
So now you mentioned that several organizations, I think 13 major components for the Department of Health and Human Services here in the region. Where are the employees? Are they all based in Boston? Are they dispersed throughout the New England region? You know, structurally, are all 13 organizations represented in each of the 6 states? What does the structure look like? How many employees?
Not exactly. Okay. There is the biggest center of gravity is at the John F. Kennedy building,
okay.
Which is where a lot of the CMS staff resides. But we do have operating divisions in other parts of the state, although not all. We have regional offices. We have a field office for the FDA, the Food and Drug Administration, right in Winchester. So sort of outposts that you may not realize in Massachusetts and in the other states. There's work is getting done in the field, work is getting done in Washington, and work is getting done in downtown Boston at the John F. Kennedy building.
Excellent. Dr. Bersani, the agency that you work for, where is your office based?
We are also in the John F. Kennedy building on the 18th floor,
okay.
Health Resources Services Administration, and a few floors down from Rachel.
And structurally, that agency in the region, is that its only location?
So we have 10 regional offices. Okay. Boston is Region 1, and we also have a headquartered office for our Office of Regional Operations in Rockville, Maryland.
Okay. What's the basic mission of your agency?
So the basic mission of Health Resources Services Administration is to, obviously we are under the Health and Human Services Department, and we're the primary organization for access to health care for our population nationally. And we do this through building healthy communities, and we try to build health equity into that. And we provide access through developing workforce and providing funding to health centers. One of our big grantees, where we supply grant money, are federally qualified health centers, and those are found throughout the country. There's over 1,200 of them nationally, and over 200 right here in New England.
Yes. Okay, so that's a huge mission. And so you mentioned that you fund over 1,200 health centers. Can you speak a little bit more to that? What do these health centers look like? What programs are they offering to accomplish, you know, the goals that you just laid out as being part of your mission?
Sure. So we supply grant money to these organizations, and we have some program requirements, 19 of them. I won't bore you with what they all are, but essentially they're to provide comprehensive primary care for any individual who walks through those doors. We don't turn anybody away. We supply services to folks for sliding fee scale based on need. And we also supply services to individuals who have very good health care programs, because we offer very good health care in those health centers. Each health center looks very different. Okay. We supply them with that guidance, but each organization assesses what their community needs are and provides those services as needed.
Okay, so you mentioned you give grants. And dollar figure associated with those grants, how much money does your agency give out each year, and if you've got any numbers around New England or Massachusetts?
Well, the Federally Qualified Health Center program is just one part of Health Resources Services Administration. We have several offices and bureaus. Okay. There are millions and millions of dollars that go out each year for different programs. Okay. And each health center would get a different amount of money based on the population and the particular needs. And then there's also add-on grants that they could apply for based on the need for that particular organization or community.
Okay. Yeah, I was reading a little bit in preparation for today's show that the agency's been around since 1982. It was a bringing together of a couple of different entities that existed at that time. Organizationally, have there been other changes along the way, or it was that big change back in 1982 that created the agency? I mean, was the work going on prior to 1982 under different organizations?
Under the Public Health Service Act that occurred in the 70s, that's when things really changed significantly, and that's when the community health center program started. Ah, okay. We have had some changes within Health Resources Services Administration over the past decade, but mainly it's a realignment of bureaus and offices and some leadership changes. But our mission has been very consistent over the last 30 years.
I was reading that your agency also oversees Oregon and bone and blood donations. Can you talk a little bit about that?
Sure, we are involved in just about every portion of healthcare you can imagine,
Okay.
and we continue to expand. Our largest grantees are the federally qualified health centers that I mentioned before, but
Okay.
we have all sorts of training and education programs, a donor program which you spoke of. Also, health workforce has been getting a lot of attention and a lot of funding because, as you know, as a nation and here in New England, we're very short on primary care providers and behavioral health providers based on the need of the population. And so we're putting funding into training and providing incentive for young health professionals to go into those areas.
So health workforce training and incentives. Can you talk a little bit more specifically about that? If somebody's watching and they're interested in going in to the healthcare profession, how do they connect with what you just said is available as a resource?
Sure. The key term would be the National Health Service Corps. That is the big program within HRSA that supplies funding opportunities, not really grant opportunities, but scholarship opportunities and loan repayment programs for individuals who are considering a career in healthcare, and particularly those considering a career in primary care or behavioral health.
Okay.
If I'm ever in a situation where I'm mentoring young healthcare professionals, I tell them the National Health Service Corps is a fantastic opportunity and to check it out. I think the website is exactly that, National Health Service Corps.
Excellent.
And there's great demand for the services.
Absolutely.
The Affordable Care Act has opened the door to people who've never had health care before, where there is very often a behavioral health component. And behavioral health is mostly mental health, substance abuse, comorbid conditions with other health conditions. So there is a needed pipeline of workers to help address some of that unmet need and growing.
Absolutely. So you've mentioned the Affordable Care Act a couple of times. Could you just sort of briefly, because I know it's complex, tell our viewers what is HHS's role in connection with the Affordable Care Act?
Well, enrollment for sure. There's 10 regions of HHS in America. Region 1 is one of the hardier regions in terms of each state's percentage of citizens who have health care. Massachusetts is 98%, Connecticut is 97%, Vermont is 97%. So we're doing an extraordinary job getting people access to health care. Some of them, most of them are through state exchanges, as they are in most of our New England states, with the exception of Maine and New Hampshire, where it is a federal, the healthcare.gov site, but people are getting what it is that they need, and we are trying to meet people where they are. I've learned an awful lot about rural health care. We have rural communities in Massachusetts, which is my lens of the world before now, but there's a whole lot of wilderness north of Portland, Maine.
Absolutely, and Dr. Bersani, to that point, your agency actually does a lot of work around reaching individuals in rural areas. Can you speak to that a little bit?
Yes, so several of our federally qualified health centers are in the rural regions and supplying health care to individuals living in rural populations. And we try to be as flexible and adaptable as possible based on what the current needs are of a population. For instance, with the opioid misuse problem going on across the country and here in New England, recently Health Resources Services Administration decided to put out a grant opportunity for organizations. It's called the Rural Overdose Reversal grant project, and it's going to supply funding to not only our health centers, but to other organizations that help the community, such as firefighters and police forces, to have naloxone available for reversal of overdoses so that we can save lives. And part of the contingency in that grant funding is that those individuals who receive that care and their lives are then saved, that they get referred to treatment at a facility that's appropriate for their situation.
Okay, so let's talk a little bit more about that, because obviously the opioid crisis, it is a crisis.
Yes.
And it certainly is a crisis here in New England, here in the state of Massachusetts, and across the country. You just mentioned this program. Now, when I was, again, doing a little bit of research, this is a very new grant program. I mean, literally just announced, or how new is it? And what are we doing to really get the word to these communities about the process for accessing these monies so that they can have this life-saving drug available?
No, great question, and that's a real challenge for us because we are really well connected to our current grantees, like those health centers I spoke about. But it is hard to get that message out about what opportunities are out there. There is a website called grants.gov. That's simple, grants.gov, and it tells you about all the grants that are available through the federal government and through HHS, and of course through Health Resources Services Administration. That is the reversal program I spoke about is hot off the presses. The grant applications are going to be due sometime in the next 6 months. Okay. There's also a brand new program called the Substance Abuse Treatment Expansion Grant, Services Expansion Grant. It's tough to keep up with all these terms. In fact, that's why we have so many acronyms.
Yeah.
Sometimes I think we just forget the names and use the acronyms.
Right.
But this Substance Abuse Services Expansion Grant is specifically for our health centers, the one I spoke of before, to provide in-house treatment, medication-assisted treatment for opioid misuse or opioid use disorders. And they can use that funding in a variety of ways. They can either provide that service right in-house within their doors, or they can have contracts with organizations close by to help their patient population deal with that problem.
Okay.
There's a couple of different kind of like medical assistance. One is the Narcan, which is the naloxone, which is the reversal. So someone's OD'd, and it literally reverses, death in many cases. And the other is medically assisted treatment, which is things like Vivitrol and some of the medications that people can take if they're addicted to control cravings. And it is an important part of the whole overall picture of treatment. And treatment is really sort of the frontier that we need to get a lot better on, because this is a type of addiction that has a very long tail.
Right.
People the odds when people will go to rehab and then they're done with it, at this point we are seeing are long.
Right.
So it is a lifestyle change, and there needs to be a lot of scaffolding around that individual going through addiction treatment.
Again, this is a crisis, so I want to spend a little bit more time on this, but I want to take a step back because, again, as I was, making some notes, and my mom asked me, she's 89 years old and she lives with me, and, you hear about opioids all the time. And she said, what are opioids? So, doctor, maybe can you give our viewers a definition of what are opioids and why it seems all of a sudden in the past year or so, why are we hearing that this is a real epidemic?
So opioids are analgesics. It helps with pain, okay? And I want to emphasize the majority of opioids that are prescribed in primary care providers' offices are useful, helpful, and not abused. However, they do tend to be addictive, and individuals who take them over a long period of time can become addicted to them. There's different ways to utilize them too, and as you break the substances down, they can be even more intense. One of the problems, of course, that people hear about is that the bridge from opioids to heroin is a simple and a natural one for many individuals, because once they lose access to opioids, which are restricted, of course, as they should be, they find easier, cheaper means to maintain their addiction, and that's through heroin, which also is a very dangerous substance, of course.
There's been some statistics that say that 4 out of 5 heroin addicts in this day and age started through some kind of prescription misuse. Now, there's a lot of prescription pills out there, true, that is used, rightfully in most cases, in many cases, but there's enough pills like of an opiate nature for every American for 30 days.
Wow.
So there is a lot of this out there, and the question is, has there been enough responsibility within the medical community to ensure that people aren't getting addicted? And so it's a multi-step problem. Like prescription monitoring, electronic monitoring in states. The doctor shopping, like how do you control and contain that? And when you're an addict and you're paying $80 a pill, and this is a cycle, and many of them lose jobs and lose, their children are, in foster care. There's all sorts of problems that come along with it. the cheap, obvious substitute is a $10 bag of heroin. So you see, like, prescription, uses are going down, but it is an absolute inverse proportion to heroin use going up.
Okay.
In New England.
So, Director Kaprielian, you talked a little bit about HHS's role and dealing with on-the-spot overdose, and then in treatment, so that people stay healthy and they stay well. But again, to really take a step back, what is the Department of Health and Human Services and its many components, not necessarily just HRSA, doing around prevention?
Yeah, well, that's a very important question. I mean, there's a multi-prong, and there isn't, I don't think there has been enough attention out in the world on prevention, but that is definitely part of HHS's priorities, Secretary Burwell's priorities. Right now, it's the real crisis in giving people access to treatment is probably the most acute, and that is ensuring that people have treatment where they live, which is very often through their community health centers, is making sure they have help with medication-assisted treatment, and ensuring that they have those processes around their lives so they can stay clean.
And I think sometimes prevention is hard to define, because if you're really talking about prevention, it's sort of hard to measure, because if it didn't happen, you don't know if it would have happened anyhow. And
Good
so
point.
I think prevention really starts with our community at very young ages for our children and moving all the way up. I think as close as we can get to prevention, we have tried to put some resources behind that, and one of the things that we do is we provide funding for screening and brief intervention for our primary care providers to ask the right questions, to do the right assessment during a normal primary care visit, so that we can nip things in the bud for an individual and make sure that they're aware of what's going on, and then also providing them the resources that they need early on. And we also provide funding for healthcare education for our physicians and other providers who can prescribe medication about effective ways to prescribe medication, including opioids, and also other techniques, behavioral management techniques, to help people deal with chronic pain. Because that is a real significant burden for an individual. And you can easily see, anybody who's experienced any amount of pain, acute pain for a period of time, can easily see how a medication that could get them out of that would be so attractive.
Director Kaprielian, can I ask, are you seeing this problem unfold differently in the different states, or is it, is it the same in Maine as it is in Massachusetts? Are the strategies that are being deployed to address the issue, are they different from state to state?
There's a lot more coordination among the states, because this is a regional problem. I mean, some of it's literally physical when you have I-91 that crosses through 3 states and where a lot of the drugs are coming down. So there's a whole criminal enterprise element to it too. So the governors of the New England states have been working together with various task forces. We are trying to coordinate some of that with some of our federal partners. I mean, no two states are exactly the same. But Massachusetts has a pretty acute problem, as does Vermont. The governor of Vermont, Peter Shumlin, devoted his entire State of the State address a couple of years ago to this crisis. That's what he talked about for his whole state. New Hampshire, it's becoming, Manchester, New Hampshire, last weekend, I think, had 6 overdoses in the span of an hour or 2. So it is really happening everywhere. Some of it is police chiefs. In Gloucester, the police chief is saying, look, we will not charge you criminally. We're going to get you into treatment if you come to our police station. And other communities in Massachusetts are mimicking that. And we'll be seeing more of that, I think, around the New England
seriously,
states.
the police chief in Gloucester, hats off to him. What a wonderful model.
Well, he cares about his community. He's looking at his community, seeing what's happening, and that is an important part of all of this. Yes, HHS is an enormous organization that covers the whole country, but it really does need to be coordinating with what's happening in the communities, in the towns, in the regions, in the the wilderness, where there's rural health. I mean, there are hospitals in parts of New England where 50% of the babies in the babies ward are born addicted.
Oh dear God.
So it's a problem that is not a short one, and it is not getting better.
Okay, so if every police chief in Massachusetts, if every police chief throughout New England was ready to step up and say, yes, we are going to approach this exactly the same as they're doing this in Gloucester, or conceptually that model, help versus incarceration. Are there enough treatment facilities out there? Are there enough legitimate treatment facilities, beds available for whatever the program needs to be to help everybody?
So I can't answer that question for you definitively because they aren't all under the federal purview, of course. But the obvious answer for most people is that that's not the case, that there's not enough treatment out there. And I think that there's some primary issues with why that is. One is that, unfortunately, the perception of people who misuse opioids or other substances is not favorable. And there's the whole not in my backyard syndrome. You hear about an opioid treatment program going up down the street from you, and people do not want that. And that is unfortunate because these are just human beings who happen to have a disorder based on some actions that they took earlier on, and they need the treatment. The other is that there's a lot of restrictions on physicians and providers who can provide those services. That they can only provide the medical assistance treatment to a certain number of individuals. So there's licensing restrictions. The third is that there are limited workforce. There's not as many doctors and providers who have training to treat addictions.
Yeah, that's a really important point, that there needs to be a better served pipeline of people who can be counselors, who can be help with some of the complicated elements of the mental health components of treatment. This is a lifetime struggle for recovering addicts, and it was a bigger struggle in the earlier years, and we just have to ensure that we are paying attention to that and making sure that we are giving people that access, and that's where they live and where they are.
And you've both made that point, where they live and where they are in these community health centers that are out there. But to our viewers who are watching that may have an issue themselves or a family member with an issue, where can they go in terms of the Department of Health and Human Services? Is there information out there on a website? How do they contact you to get information about what you offer in this regard?
Yeah, well, we have a couple. So the SAMHSA website, which we'll have on your screen.
Okay, SAMHSA stands for?
SAMHSA, Substance Abuse and Mental Health Services Administration.
You got it.
Okay.
SAMHSA.
Okay.
Yes.
And I would be remiss if I didn't say that HRSA, Health Resources Services Administration, didn't work very closely with the Substance Abuse Mental Health Services Agency. And that is one thing that has changed over the last 5 years, is that we now have regional representation for the Substance Abuse Mental Health Services Agency, which we didn't have prior. And that has made a huge difference in knowing what resources are going to whom, and to leverage the federal resources going to the community. So that has been very, very helpful.
And the federal government is big enough that it can be a very good coordinator, a very good convener, and a very good data collector, which Secretary Burwell is making a strong priority to make sure that we have some of those data sets available to the state, so they're able to utilize it when they're looking for grants and looking for other avenues for helping people in treatment.
But to go back to your question, I'm sorry, HRSA.gov, HRSA.gov has a list of all of our health centers that are out there and in your community, I'm sure. And that is probably the best resource I could offer you, but SAMHSA also has their own website, and also provide you with some websites for integrated behavioral health care, which is another initiative of ours.
Yes.
You know, we've covered an awful lot of important information, really just at scratching the surface very, very quickly, but we're nearing the end of our time. Is there anything that you've not shared with our viewers that they need to know?
I think my parting statement will be about the Affordable Care Act, and how for the first time really in the American history, there is now the ability for anybody to sign up for health care. And we have done great in my region's states' websites, ensuring people have access to health care, but this is really an important element. If you need to get substance abuse treatment, if you need to have mental health counseling, if you need to have a good primary care doc, it's good to make sure that you're covered, and we do that now. Healthcare.gov.
I would just say thank you for having us. These are the sorts of things that I think oftentimes our federal resources are not as well utilized as they could be, and a lot of times people don't have that information available to them, but the resources are there, and people should access them.
Excellent. Well, thank you. I want to thank our guests from the Department of Health and Human Services for being with us today and for helping us to better understand the work of the Health Resources and Services Administration and what the federal government is doing to assist with addressing the opioid crisis. I thank you for watching, and I hope that you will continue to join us as we feature other federal agencies on your federal government.